medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
One of the problems that we face as clinicians in our practices is the constant hearing of the same type of symptoms. And one of the symptoms I want to do in a 3-part series with you is fatigue. I know every single practitioner hears the word fatigue, and the question is, how do we deal with it? What causes it? What are the causes? What are the diagnostic procedures for it, and how do we treat it? Hey, I'm Dr. Mitch Ghen, and I'm going to try to give you some of that answers. First, let's talk about the things that can create it in this part 1 of the 3 series. One, of course, is nutritional deficiencies. Obviously, deficiencies in many different nutrients, such as B complex or any of the B vitamins, has a proclivity to cause that issue. Vitamins such as CoQ10 or anything that stimulates our mitochondria to produce energy will also create fatigue and a reduction of adenosine triphosphate. Mental health issues, especially chronic anxiety or depression, people enter pretty much with fatigue as part of their whole problem. Sleep disorders like apnea and not getting enough 6, 7, 8 hours a night is also an issue. Junk food, for example, with lots of carbohydrates is an issue. And even medicines such as too much blood pressure medicines and beta blockers and things of that nature also can cause it. Then there's things that we don't think about, like working out too much. We know smoking, but did you think about if you work out too much, you're creating so much antioxidant activity that you're literally stressing the system, and we're not taking enough antioxidants or doing IVs to reduce it. Undiagnosed heart disease. People that have heart disease obviously don't have the same amount of circulatory necessity, and decrease in cardiac output, etc. Ejection fraction will lead to having a problem with fatigue too. Thyroid disease, well, you know that one. The thyroid's not functioning well, and there's a lot of subacute thyroid disease, which we will take up next time. The thought that thyroid disease is a reason, especially when it's hypo, to be something that causes fatigue. Even hyperthyroid causes significant fatigue as well, especially if the heart rate's elevated simultaneously. Dehydration, which you may not even have thought of, is the #1 cause of midday fatigue. Even being off by 1 glass of water can cause us to, and your patients, to not feel as well as they should, nor think as well. The #1 constitutional symptom of allergies and also of infection and other diseases are and is fatigue. Autoimmune diseases all cause fatigue. Cancer causes fatigue, of course, after it gets going. Lack of the proper hormones, losing your joie de vivre, your thirst for life, all related to fatigue. Viruses, specifically like EBV, although any virus could do that. You know, when you have a cold, you're tired, or a fever. But Epstein-Barr virus 4, which is the one that can re-come back, it's very common. 95% of the population has had mononucleosis. And after the age of 40, this can reoccur if the immune system is not healthy, leading to severe fatigue. And diabetes, of course, once the diabetes is out of control, there's a lower production of adenosine triphosphate, our energy bonds, and therefore fatigue again. And we don't want to throw away toxic metals because they too can cause fatigue. So if there are toxic metals, they can and will contribute to poor ATP production. Now this is a mouthful. It's a lot to think about. And what I'm going to do in part 2 is I'm going to dissect each one for how you could test for it. Now, if you're testing in your practice for only a little bit, you're going to miss the rest of it. So a comprehensive 360-degree approach is most important. Being a good clinician means pretty much putting to bed almost all the potentials, if possible. You never get all of them, but putting to bed at least 85 to 95% of the potential issues that can cause fatigue. If you look, you will find it. Waving your hand as a clinician, which I see many times, patients come to me and tell me their general internist told them, or family doctors, that you're just getting older. Don't worry about it. Forget about it. Yeah, no. We are different. We're integrative practitioners, and our job is to discover the functional dysfunctions that do occur from the things we talk about. More about this in our next installation. I'm Dr. Mitch Ghen. More information, just go to drmitchghen.com. That's drmitchghen.com. And as always, thank you for watching.